Welcome back, everybody, to another episode of Q&A with Dr. J, who has a very colorful background today. You can tell that she might not be in her usual digs. She's actually traveling around this summer working with patients in different locations and working with some of our practitioners to really give them more of an in-depth training in holistic methylation and My Happy Genes. So good to see you, Dr. J.
Yeah, good to see you too, GC. It was fun to actually see you in person for a minute. That was nice.
Yeah, Dr. J and her two dogs had lunch with me here on the farm, and it was really nice to see you too.
Yeah.
Okay, we often talk about genes. We don't often talk or ever talk about my happy genes. What makes my happy genes different? And I know one question that I had when I first discovered your company was, what is this algorithm you talk about? Everybody's talking about AI now, but years ago you had to design with a coder an algorithm that parses our symptoms and matches it to the genetic profile after it's done. So can you walk people through the process and tell us a little bit about why MHG is different?
Yeah, it's a good question. And it's what drove me to create my own system because I saw a lot of companies that were doing gene testing, but they were very linear. If you have the MTHFR gene, then you take methylfolate. If you have the COMT gene, you take this, blah, blah, blah. And it was like one gene, one supplement. And that's not the way it works. We discovered that through working with many clients in the clinical setting in New Mexico when we were first starting to work with this information. And what we found was that the minute we started to upregulate a particular genetic variant or the effects of that genetic variant, then other things were affected downstream. And you have to take that into consideration. And we actually talked about that a little bit where, everybody that's got the MTHFR gene, they're taking methylfolate, but they feel terrible because their body turns on detoxification pathways and it's too fast. If they've got another genetic variant down below, it causes a backup of problems. And that was the key, really, to understanding how all of these genetic variants work and how they work together. So when I started this company, I talked to my software programmers and I was like, can you design an algorithm for me that takes into consideration if you have this gene and you have this symptom? And that's the other thing that the algorithm calculates in there is not only the interplay of the genes, but also the symptoms that the patient is having. Can you design that for me so that there's that interplay of information and have it spit out accurate diet, lifestyle, and supplementation? And you and I both, GC, have gotten reports back from other companies that are very contradictory. I remember in the early days, I did my genes, and one of the recommendations was do folic acid, and another recommendation was don't do folic acid. And it was like that, or it recommended chocolate milk as my best food.
What?
One of them actually was chocolate soy milk as my best food, and I was like, "Are you kidding me?" It's like probably my worst food. But and so I was really frustrated at what was out there, and so I wanted to create a program that was much more accurate, but took into account what we found in the clinic when we were working with these genes.
Yeah, it's interesting that I've had a similar experience because just for the heck of it, I tried other companies. And I may have even mentioned this on a Q&A. I have hemochromatosis, which means that I store iron. Like my body just doesn't get rid of iron. And one of the recommendations was to eat iron-rich foods and something else. And I thought, there in the profile are the two genes both related to hemochromatosis, but it never translated that to the recommendation. I think the recommendation might be based on you're a woman of a certain age, so you need iron. And
Right.
those generic kinds of recommendations can really screw you up.
Absolutely. And yeah, they are generic. And there was another company where they were designing a product. So it was like a shake
Hmm.
and putting in all the things that they recommended into the shake. And there was a breakdown of the ingredients. It was like a multiple, right?
Yeah.
So I got my list and then I did my partners at the time, I did his and got his list. It was exactly the same as mine.
Oh,
And then I did three more people and it was exactly the same. And I
oh
was like,
man.
oh, seriously? They make it
Wow.
seem like you're getting a unique blend of things, but it was the same. I was like, all right, rip off.
Yeah.
And another problem with a lot of the companies is they don't test enough genes. They're just testing maybe six. There's one company that tests 6 genes and they're charging, what, $600.
And you can pay for another four or something. It's an upgrade. It's what?
What? And we're reporting on 670 or 620, I think, at this current count, genes and the interplay. So it's much more robust. And that was why we stopped using 23andMe and Ancestry too, because they only test for, when we started to get the reports printed out, half of the genes were missing out of the whole gene code that I got from 23andMe and Ancestry. So they were missing a bunch of the genes that we know are important for looking at our biochemistry and physiology. They're looking more at Ancestry. So it's a whole nother
Right.
set of genes. So we had to go and get a private lab to do the genetic testing. And they use Illumina as their chip, which is 99.9% accurate in their testing. And that's another thing that was important to us. And another important piece was the privacy. A lot of companies are selling your data and to third-party companies, and you don't know where it's gone or what that will mean in the future. So it's a little scary to think about your data roaming around out there. But very passionate about that piece as well. And so that's why we designed it so that nobody knows that's your data
Right.
except you.
Your name is not associated with it at all.
No, no. I had a patient this morning who made up a false last name, and that's just perfectly fine. You could put Mickey Mouse on there. I don't really care. As long as you know that your email is connected to that gene report and I know it's you. I don't care what name you put on there or what email you use. You can use an incognito email. So there's a lot of ways that we protect that privacy.
And for anybody that wonders why, so we have tests, reports that you can only get with a practitioner. And we've talked about this in another video. The reason I mention it is if you think, how is a practitioner going to know just by reading my genes what I need? Well, A, there's a training course that they are required to take before they become a practitioner, but also the algorithm shows them the correlation. They would have to spend hours on every single individual report to do what the algorithm can do in minutes, right? So it's not that they're so smart, although they're really pretty smart. It's that this algorithm that you designed or that your software programmers designed is smart enough to crunch the data and then give a reliable indication of what the person will need to feel better.
Yeah, and that's exactly why we did a software program, because I was teaching around the country. We taught over 600 physicians how to do the work using the holistic methylation system. But a lot of them were like, oh my God, this is too complicated. It's a lot of biochemistry, it's a lot of genetics, and it was too much for some of them to really incorporate into a busy practice. So I'm like, all right, we'll create a software program that'll do it for you and then give you a nice report that you can take to your patients right away. Like you say, it has the information there so that they can just look it over. But we do want to make sure that you are in good hands when you're looking at these genetic reports, because it's very powerful medicine, if you want to call it medicine. We want to make sure that we're not contraindicated with anything you're taking already, medications or other supplements that you're taking or health conditions like yours. If we didn't have that gene report and just recommended off of a different gene analysis that you take the iron, we could really hurt you. So it's scary.
Yes, the symptoms of too much iron are very not fun.
Yeah.
So I would know pretty quickly, actually, if your report recommended something, I'd be like, why are my joints hurting? Why am I not sleeping well? Why is my stomach upset? But that's what happens. Yeah.
Yeah, interesting. And I've caught a few hemochromatosis patients just off the genetic test that
Mm,
didn't know they had it. And so sure enough, because an iron isn't always tested on
no.
a standard test, nor is vitamin D often tested. And we find often that people have a genetic variant in that vitamin D receptor where they don't absorb D. They go to their doctor, get their gene or get their vitamin D levels tested, and sure enough, they're real low. They can't absorb vitamin D, so they're going to be low. But
There's also too for some reason, my insurance, and I'm sure this happens to other people, if I have a blood panel that wants to be done, they will make me sign something that says your insurance is not going to pay for this vitamin D test.
wow,
It's part of the profile, but I don't know whether, and
wow.
so I always say, yes, I'll pay for it. It's fine. And then it ends up being $27 or something. But it's just, but that will put people off. These tests are important for us to know. there's thousands of tests, but I'm just saying something as basic as vitamin D, because vitamin D is such an important prohormone. But
Yeah, it is incredibly important for our health for so
mhm.
many things. I'm surprised that they're not paying for that. You'd think that insurance companies would care about being proactive in
Yeah.
you would think.
Prevention, wait a minute. You can't make money on prevention, Jay.
Oh, sorry, silly me.
Anyway, for anybody that wants to know specifically, if you've looked at other companies, how we're different, go to the myhappygenes.com homepage, scroll down a little bit, and there's a comparison chart that we did specifically so people could not wonder how we're different. You can just take a look for yourself.
Absolutely.
Thanks, Dr. J.
Thanks, GC. Good to see you.
Yeah, good to see you. We'll be back again, peeps, with another episode of Q&As with Dr. J.